very honored to be here today and be able to share some of the different work that we're doing in Camden, with a mind towards how Glassboro can replicate some of our work. There's clearly overlaps between Glassboro and the city of Camden, and then obviously some things are different, but I really hope that you'll have some takeaways about the approaches that we've made. I tried to make the overarching theme community development, which just so we understand, it's this idea of eliminating poverty by supporting our residents' capacity to make the changes that they need. We want them to become the stakeholders who can steer the ship. And the best ways that we can do that is to help them identify their own assets, what makes them unique and special, and help kind of build them up into capital, which doesn't necessarily have to be financial. It could be human, it could be natural, built all sorts. But once we're able to cultivate that capital, we believe we are giving our residents the tools and resources to become their own stakeholders and making decisions that better themselves and not having to rely on outside forces. And so for this presentation and what we've been doing largely in Camden is cultivating those assets through food and really trying to create employment opportunities in the food economy that could be giving the residents an opportunity to really take hold of their very own food system and make it work for them, and also employing one another at the same time. And so here's just a quick agenda. It'll be an overview of the work I've been doing, as well as our partners, the food system and our health, and how that relates to the work we're doing, and then getting into community food resources, what we're doing in Camden that you guys might be able to learn from us, state and local policies that influence this work, and a little bit getting into the excess produce and the opportunities that this challenge can present. As Leslie was mentioning, I should talk a little bit about myself. So, hi, I'm Jonathan Wetstein. I was a graphic designer that turned land use planner, turned urban designer, and then pivoted to community development as starting my own consulting about 11 years ago. More recently, an adjunct professor at Temple University in community development and food systems. But really, I'm here because of the work I've been doing in Camden since 2010. And that's working with nonprofits to work on a variety of community-based projects that focus on health equity, and job creation through urban agriculture. So I'm not the guy with the welder, but the project manager. I help kind of raise the funds. I try to connect the partners and get to apply some of my design skills whenever necessary to bring about an improved quality of life for residents in the city of Camden. Currently, which is the main reason I'm here, the program manager for Parkside and Camden's Roots to Prevention Partnership. And this is a cross-sectoral collaboration. So this is government, it's institutions, it's residents, it's farmers. We're all working to focus on how to address and reduce the rise of chronic disease, health conditions in our families and residents in Camden. And we're doing it in 3 impactful ways. Together, we are working on distributing and increasing the availability of prescription food box and food box vouchers so that patients and their families can afford healthy, fresh produce. We're providing and increasing opportunities for those residents to also be a supplier of those foods. So really trying to think about how they can be a consumer and also a producer of those very same foods. And making sure that all the great programs and services that are available in our healthcare systems can reach everyone. So working with corner stores, working with food pantries, and trying to figure out how our partnerships can ensure that these prevention programs and resources and tools are accessible throughout the city. This collaboration did garner a national award from the Build Health Challenge in 2019, which has really allowed us to test out these ideas on primarily how do we get our urban ag participants eligible to grow and sell produce to the health system, and how can the health system prescribe that produce to their patients, and really see how this food economic process from a health and social services standpoint is a really viable option, in addition to just working on legitimizing urban agriculture in the context of the USDA, the State Department of Agriculture, 4-H Club, et cetera, et cetera. So We acknowledge those resources are out there, but we really see merit in our healthcare partners and social service providers. They seem to really understand the importance of urban agriculture in a much more deep way and are quicker to support our work. So there's a lot of health sprinkled throughout this presentation because that has been a huge help for us. As you can see, Rowan University is one of our partners. They're the ones kind of spearheading the data collection and impact of this work that we're doing. We also have the state's largest health insurer as a partner of ours, as well as Virtua. And I come from the top part, the Parkside Business Community Partnership, which is the community-based organization that spearheaded this collaboration. And so kind of zeroing in on that, Parkside Business Community Partnership, for the past 10 years, this nonprofit community developer has been looking at ways to create equitable green jobs in the space of healthy fresh food cultivation. That's where I got pulled in. And it's been an incredible journey so far. We started off with this roots to market idea of just helping families learn how to grow and sell produce, helping build raised beds in their backyards, and trying to create sales channels through the Food Bank of South Jersey. Very onerous. Do not recommend going around putting in gardens in the backyards. So we pulled back and focused more on the facilities, getting larger backyards to invite everyone over together, give them the tools, give them the programming that they could bring back to their properties. Much better idea. So much better. We ended up building a second facility with multiple raised beds and a fruit producing orchard. And so that allowed us to get to a level of more recently where we can work with you guys on things like ADA accessible raised beds and affordable housing developments. And so the programs that Risk to Market provides still goes on. We just took the resources from building just backyard gardens into really consolidated space where we can have a better oversight over the quality and condition of the produce being grown. And so here's just some shots of the programming that we would offer. This is called Root Camp 101, giving everyone the basics and foundations to gardening. And we do this every year. It's been successful, but we also understand that not everyone is crazy about getting their hands dirty. So a couple of years back, we unveiled Root Camp 102, which is all about what you could expect. What do I do with all that produce once it's harvested? So in this series, we give our residents exposure to value-added food products. So how to make jams, jellies, pickling, even soaps and incense. So a whole variety of other items, you know, to also broaden the exposure of what it takes to get into the food economy. You don't necessarily have to grow tomatoes. You can actually make some great products with produce that your neighbor is growing. So with that in mind, Virtua had put together this other program called Eat Well, which was an initiative to provide greater access to food, nutrition, dietitian, and social work supports. So it was through those conversations and discovery that I had asked the health system, could you guys buy the produce from our residents if you're already prescribing these as medicine? They agreed to look into it. And so that's basically how we got to roots of prevention. And so through that partnership, we grew to where we are now, which I already showed you. And we're really trying to figure out how the growing need for fresh foods in the health system can really become a community development tool that provides employment and income for residents who may not even have the resources to purchase fresh foods. And so that great transition for the food system and our health. Question for you all. You know, we've spent about 90% of human history as hunters and gatherers. What made it possible for us to leave this way of life and start ordering meals on Grubhub within the last 15,000 years of our existence? Does anyone know?
I have a guess.
Yes.
Is it vehicles?
Close. I'm talking like what happened 15,000 years ago that got us to that point. And
I'm thinking Grubhub. I'm like, that was recent.
So
Yeah,
I, I would just guess agriculture.
Yeah.
I mean, just the ability to farm and grow things, and then you figure out how to store and package things, and not even package, but just how to preserve and store things. Yeah.
Yeah, thanks, Leslie. So yeah, it has been coined the term agriculture revolution. It actually happened over thousands of years. It wasn't a big fad or anything, but it was in that moment that we started to stand in place and grow intensive crops that we were able to become urbanized. Then we needed sewage, and then we needed infrastructure. Then we needed all these other elements. And so what has happened in the last 15,000 years is it's progress and it's evolution, but it's also a lot of unintended consequences that we then have to come up with solutions to fix. And so for better or for worse, our food system will continue to create challenges for us that we have to kind of come together on and fix and adjust. And it's just part of the process of having a very complex logistics supply versus playing music, gathering some food, fishing, and just relaxing in the hut. You know, there's pros and cons to both. Although for many in the healthcare field, a lot of the diet-related diseases that we have today would not have existed had we just stayed as hunters and gatherers. So it's kind of an interesting, you know, question to pontificate on at another time. But yeah, so this is what we have today, the conventional food system. It is a process that is about scale, keeping the cost of food down, the variety is low. It's about consolidation of the supply chain, vertical integrations. And then where we're working on is the alternative food system, which is much more of a small, autonomous, scattered network of food production, which is a lot more resilient and a lot more equitable, creating more meaningful opportunities for income, and also just thinking about access. Not everyone can access fresh food in the conventional system, but with an alternative system, essentially anyone can. So there's other versions and varieties of food systems, but just so everyone can kind of understand the challenges that we're currently facing, that I'll get into more in this, is coming from this conventional. The food system is a larger economic, political, cultural, environmental system that we live in. And what we're trying to do is combat a lot of the fallout of the conventional system by supporting alternative local food systems that in many cases will be urban. And for those that are more visual, this is what a food system is basically looking like. You have your processing, your production, the resources that go into it, including labor, thinking about the waste, the consumption, and how it's all exchanged. As you can imagine, in a conventional system, some of those circles might be happening 3,000 miles away. And if there's a problem 3,000 miles away, it can disrupt the entire system. Some of these items might be coming from further away. And we're going through some of this right now with food prices, where we really don't have a lot of control over what foods we want to eat. And we certainly don't have a lot of say on what those prices are, because the conventional version of this bubble is very far spread out. So these are things that communities like Glassboro can start to think about, because with the food system, you have challenges of inadequate wages for labor, a lot of environmental problems with intensive crops affecting the ecology of the land, greenhouse gases, runoff, nitrates in drinking water, a lot of environmental justice issues, particularly with industrialized livestock. And then what I'll be covering a lot more, the health side of the food system, where we have many communities who have limited access to income and mobility, so they're not able to even purchase fresh, nutritious foods. They're left with just the processed high sugar, high sodium fast food that's in their community. And so that's where our response has been. But certainly an alternative food system addresses income and addresses the environment as well. So our alignment with the healthcare system really starts with this idea of a social determinant of health. You know, being real about the fact that our healthcare costs, you know, are predominantly dominated by treating chronic diseases that can be prevented, over 90%. And so we know that our healthcare providers understand the cure is prevention. But the challenge for them is that prevention happens outside of their office. And so we in Camden, with our collaboration at Roots of Prevention, are trying to work on ways that the investments that the healthcare sector provide for their patients will continue after month 7 of the, some of their wellness programs are enrolled, go for about 6 months. So we're really trying to think about how month 7 on, what kind of support can be put in place so that residents continue to live healthy. And again, if they can be part of the food system solution, they're going to be able to have access to the income and the supply necessary to stay out of the hospital. And so income is absolutely a very important piece of living well and living healthy. And so because of healthcare's interest in social determinants of health, they began to collect data from their patient population with these chronic diseases that were linked to diet. And they began to go through a 2-question program that allowed them to diagnose a family as being food insecure. And this allowed them to deploy new tools to combat social determinants with a specific mind towards diet. And so currently in a health system like Virtua, for example, if a patient is screened positive for food insecurity, they don't know where their next meal is going to come from or when, and they have at least one morbidity, whether that is hypertension or diabetes, obesity, things of that nature, they will then have the option to get enrolled in their wellness center where they can learn about how to prepare healthy, fresh foods that treats their diagnosis. They'll have food bucks and vouchers to afford those items, and a social worker to kind of help them figure out how to sustain that lifestyle moving forward. So it all starts with screening. And this is something that has really catalyzed the support that we get from healthcare. And so within just Camden, as you would expect, as a food desert designated community, this just shows you what the state average is versus the county versus the city for hypertension, diabetes, and obesity. So they're very serious, our partners, in addressing these challenges. And so we understand that the food system is not working for us in a health equity standpoint. Not everyone can live as long as the next person. And that is often being determined by the census block or the census tract that you live in. If you're on one side of US 130, you're going to live longer than the person on the other side. And we're so grateful that we have partners at Roots of Prevention that understand that that's not okay. And if we can build up an alternative food system, we're going to see that the patient population is not only more resilient, but they're also able to create that food sovereignty. And this is a very important aspect of community development. They're now stakeholders, so they can really take ownership of their supply, the cost of the food, where it's coming from, how fresh is it. And that's really what we're all trying to work on, is really creating that system that is going to keep families healthy without the endless cycle of families coming and going from the hospital, being dependent on medications they may not be able to afford. So that was my info dump. I wanted to pause here just to see if anyone had any questions. The next section is just to kind of give you some examples that could be useful for the work that you all are doing. Okay. And then feel free to put questions.
Jonathan,
Yes.
can you say something more about the virtual mobile market and how that works? I don't know if that's on your examples coming up, but oh, okay. Then you know what? Give your examples, because I think that's what I was going to ask about. Okay.
Yeah, no, absolutely. And I'm sure Megan really gets this already, but our health system is taking this very seriously, as I mentioned before, to the point that they are literally getting into the grocery business. And that has been such an interesting change from where healthcare was even 10 years ago. And so looking at the city of Camden, here's Virtua. They have 2 hospitals. Cooper's right here. I'm not downplaying them. They're just not one of our partners at this time, but they're a phenomenal health system. Cooper Pete's doing very similar work. We're looking to collaborate soon. And so over at their main facility, they constructed about 3 years ago this wellness center. It has a variety of different programs to promote wellness, but the one that I'm zeroed in here is their prescription food pantry. So again, patients screened for food insecurity, have at least one chronic disease linked to diet, they can get referred to this food pantry. And so for the last 2.5 years, they would receive consultation on how to manage their condition with the right foods. They're given the foods for free. And now we've created, through our collaboration, a prescription they can also redeem at a corner store, so they don't have to schlep back to the hospital. They can also go to their neighborhood corner store to maintain their habit of eating well. So we're trying to bring this wellness center out into the city. And we're not doing it alone, as Leslie was alluding to. They themselves took a city bus, a New Jersey Transit bus, and converted it into a grocery store a 1.5 years ago. And so this bus is filling in the gaps of not having a full service grocery store in the city. They have several points that they go to provide slightly below the cost of the grocery store pricing. And just to cover all bases, they also have 2 mobile farm trucks that are using locally sourced produce because of roots of prevention. And those are even cheaper prices, slightly subsidized. So you have a food pantry that's 100% free. Then you have, really the next price point would be the mobile farm truck. And those also go around to scheduled stops. And then you have this full service grocery store that's almost at market price. So we're really trying to cover all income thresholds and cover the varieties necessary. And what do you know? These are potential sales channels for all of our growers. So when we're working with our resident growers, they're not just looking to sell at the wellness center. There's now 2 farm trucks and a mobile grocery store bus, in addition to Healthy Corner stores that are all potential sales channels for families in the city. And Travis, who's on this call, is helping us lead the charge with our Camden Urban Agriculture Collaborative. So as you can imagine, getting the green light for the healthcare sector to buy Camden produce is exciting, but it's also a little bit of the dog catching the fire truck, because now the demand for produce has just quadrupled overnight from what our growers were faced with prior. So we have been working very, very hard on collecting all of our groups and all of our active gardeners to organize into one more cohesive entity and to make sure that they have all of the resources that they need to meet the needs that are growing very quickly from our healthcare providers. And so through a USDA grant, we were able to start to invest in 8 garden hubs, kind of like a garden center, so that our patients coming out of Virtua and our existing growers have access to the knowledge from technical individuals who can provide extension-like services. They can also get soil, seedlings, and other tools that they may need to ensure that we have adequate quality and quantity of produce to sell through the health system. So these are in the process of being developed right now. So we have an eye towards increasing our own capacity to produce quality produce for those programs. And then we have 1, 2, 3, 4 that are going to be growing this current season for Virtua to really test out how the aggregation, the packaging, and the delivery is going to work with Virtua's hectic schedule, because you're managing 2 farm trucks, mobile grocery store bus, patients at the food pantry scheduled times, and you're still a health system. So, we're all learning this together on how a hospital-run grocery service can get this produce on time and fresh. And so a big force that has made this start to run a little bit more smoothly has been our team at Rowan. So just a very quick thank you to Rowan for really keeping this moving. It takes a lot to get farmers and healthcare providers at the table talking regularly. And so the other part I mentioned is the corner stores. Since they're already redeeming these prescriptions because of our collaboration, we're hoping that if there is extra produce and it doesn't get used at the health system, that we will be able to get our corner stores to purchase it as well. And that's also a great way to really showcase that gardening is alive and well in the city, is when a person's going in to purchase any items, that they could see that their neighbors are selling produce in their corner store, you know. And so there is a marketing side of this we're also looking towards with stickers and packaging, just to promote awareness that some of the produce in your store is coming from your community. And the My Resource Pal is another very useful tool that's helping us. So for those who may not be aware, a lot of organizations are starting to turn towards online data sharing, so that a healthcare worker or a social worker can help individuals meet the needs that they have that are unique to the next person. And by creating these white labels through a platform called Aunt Bertha, you're able to look up in a search box what programs and activities and resources are out there that are hyper-local that would meet the needs of that specific family member or patient. And so by having Camden Coalition and Virtua operating similar tools, we quickly learned that for the social worker using this and for the family member using this tool, there wasn't a lot of food access related resources available on these platforms. And so while we're trying to get some programs and resources out of the health system and into our community, a very useful way to do that is to make sure that our programs are accessible online and through other platforms, and to make sure that those are linked to a tool like My Resource Pal, because that allows healthcare workers who you've never met to go in and search for food access, and then your work will populate, and then they'll start referring patients and residents and families to those services. So, you know, the Board of Health definitely uses these as well. So getting up there, it's like the Google of wellness and social service related support. So I'll be mentioning it again later in the slides, but just definitely want to mention that Eat Well and CCHP both have them up and running, and we're trying to fill the gap on the food access side. Does anyone have any questions on that section? That was basically what we're doing in the city.
Yeah, I do. Jonathan, first of all, thank you so much for sharing those examples. I have a question about the corner store map that you showed. There were 8 corner stores listed over there. So I was just wondering how those stores were selected or chosen. Will this program grow? How does it function? Is it similar to the corner store program that we see in Philadelphia, exactly same, or is slightly different?
That is a great question. Then Melanie, I saw you raise your hand. Yeah, so one of Roots to Prevention's partners is the Food Trust, which is a national organization that has really been a leader in all things food currencies, food bucks, and healthy corner stores. And so about, I can't do math anymore, whenever 2014 happened, I was gonna say like 2 years ago, they came into the city and they started to replicate the Philadelphia healthy corner store model in Camden. And what that did was it helped build a level of trust between corner store owners and community development organizations such as Parkside Business Community Partnership. And so having the Food Trust already as a partner, they were able to work with Virtua to take their screen positive referral network inside the wellness center, and we're able to start generating portable, I guess we keep changing the names, but we call it Food Bucks RX. So it's Food Bucks that is prescribed. And so within a couple of months, we were able to create these portable currencies so patients could leave Virtua and go to a participating corner store that already was accepting their Food Bucks process. They just made a couple adjustments to it. It did take a year and a half to get those corner stores that were accepting Food Bucks to also accept this new prescription version. But that process is becoming a little bit easier and a little bit quicker. which is great because the transaction side has been a challenge because they have to keep track, they have to submit them, and then the food trust reimburses the corner store. But the idea is if your neighbor can't afford to buy the tomatoes you're growing in your backyard, if you could sell it to your corner store and they get these vouchers, whether it's a prescribed food bucks voucher or a regular food bucks currency, they are able to give that to the corner store. The corner store owner pays the grower. The resident doesn't spend anything. They just hand over that voucher and they're getting that produce. So understanding the challenges that low-income communities face when we talk about donations, the city of Camden is heavily donated with a very robust food support safety net. So if someone's really looking for free produce in the city of Camden, it's not terribly hard to find it. But if that family wanted to sell that produce, it's worthless because of the fact that there's so much of it being donated. And so this currency creates income source that doesn't disrupt that process. This is a currency where the corner store is spending the money on those residents, and the neighbor who was otherwise needing it to be free or at low cost can continue to get it at low cost. And that currency is sort of covering those bases. So we're able to run this with money that's subsidized between, that comes from the federal level, the food trust gets it, and then they disseminate that currency, and the prescription, which is subsidized by the health system. So we're driving up the value and the price for the producer, which is what we want to see in an alternative food system. But we're not disrupting the low cost, making it unaffordable for those who need that produce. And how will we plan to do that sustainably in the long term? The Food Trust is working on creating a buyer's cooperative. So you saw 8 right now, let's say it's 10 or 11 by next year. They're working on establishing a consortium that will buy in bulk healthy, fresh produce. And so that'll bring down the costs. And they're creating some other tools to help them absorb loss, because most grocers, which we hate to think about, but they overstock for the look. We want to see everything just filled to the brim. And maybe half of it's going to get sold and the rest does not. And so we're trying to figure out how to mitigate that problem, but also have things look kind of filled out. And so they don't have the financing to waste produce the way a grocery store does. So we're trying to kind of come up with ways that excess produce will get to Cathedral Kitchen, other pantries, and they can still buy that quantity that looks appealing enough to get people to want to buy. So it's a whole psychological game that we're working on. But that is our longer term goal. Yes, Melanie.
You said the larger grocers, which you don't want to think about. So you sort of answered my question, but I was wondering, is there a role for the larger grocers in this model or not? And why?
Yeah, there certainly is. We're just not at the scale yet, and for us, we love the idea of working with the existing corner stores. It's quick and easy to blame them for a lot of the health problems in a food desert because they're sort of the source of the high processed foods. But over the last decade, many of them have really come around to understanding the value, merit, and importance of having that fresh produce, and generally want to make it a reality. They just don't have the money to do so. And this is a change. Campbell's had donated money to help them 10, 11 years ago. Even got them the coolers, and many of them tragically were filled with beer. I mean that's just the mindset that we were dealing with in the last decade. But a lot of that has changed. And so we see these corner stores as not necessarily the problem, but really the potential solution. And so if we can organize them to function a little bit more similarly to a full service grocery store, because now we're getting into a space that is very much tied to the conventional food system. And the rules don't apply the way that our alternative idyllic system could. So we do have to be very much realistic about how the system is working at that scale. And so we're also looking at other types of buyers cooperatives in the future. including, open air markets and things of that nature. But as we build up the supply and we have more land available, there's corner stores that are open to the idea of carrying our produce. There's ShopRite's a great example where they are always looking to invest and support this work. And it wouldn't surprise me if others followed suit as well. Yeah, thank you. Good question. Any other questions?
Yes, I have a question. Jonathan, I'm very interested in how the backyard gardening, you managed to get communities and neighbors to actually do that. And then plus with the limited amount of backyard space, were there any issues with ordinances or anything like that?
No, there hasn't been. One of the things that works to our benefit is that raw produce is not as much of a challenge with regulation and food safety. Although everyone who's participating in programs does go through soil safety and food safety handling. It's once you get into the value added, the cottage kitchen laws. That's when you're making tomato sauce. That's where it's to sell that. You need a commercial kitchen. And so another thing that has been really helpful for us, and this kind of goes to Dave, we've used and leveraged our faith-based community for land. So we'll have families who may not have enough land to grow and participate in their own backyards. We would work with our faith-based partners to allocate a certain amount of space for residents to grow on their grounds. And in some cases, those churches were using that food, for meals for those in need. Others had an opportunity to sell it as a fundraiser, or just give it as space for families to use. And so, really thinking about how we can find consolidated lands. We've also worked with schools for that same challenge, to making sure that they have access to land. That had been our biggest issue, because even if a family did have a backyard, they may not have enough sun, they may not have proper access to water, the acidity, they may need raised beds constructed, which could become cost prohibitive. So it allowed us to help more families if we could work with folks who had underutilized space, test, control, and ensure that they have everything they need to grow successfully there, and kind of direct and steward people into those spaces. Great question, really. We were very overly ambitious when we first started with the backyard gardens, and now it's more of giving people the resources to kind of do what they need to do. Yes, Leslie.
So this isn't as much a question for Jonathan as it is kind of a statement for the whole group. And maybe Megan's here, and I don't know, Megan, this may not be things that you know about yet. So Virtua Health just made a major partnership with Rowan University. They've committed $85 million to basically take over one of our medical schools and absorb 2 other colleges, one of which is the college that I am in. And so I guess I'm just thinking, it sounds like Virtua is very interested in having a partnership with the university. There's going to be 3 research institutes that are going to be part of this the Virtua Health College of Medicine and Allied Health, I think is what it's called. And one of the institutes is going to be a cardiovascular health research institute. The second one is devoted to primary care. All this happens July 1st. Like that is the shift happens July 1st. And so I guess I'm just wondering, would Virtua have an incentive to partner to do something in the Glassboro area? Like if there was some aspect of this, like would Virtua be willing to offer the prescription bucks to people in Glassboro so that they can get produce? And I realize Glassboro is not as big as Camden. We're not going to come out of the gate with the traveling bus and all that stuff. But I don't know, like, all right, that's just kind of what I'm thinking about at the moment. I'll be quiet and let other people respond to that if you have any thoughts.
Yeah, I was just going to add, I didn't get into the studies because that's like a whole other presentation, but the efficacy of our portable food box prescription program is being compared in the city of Camden to the Mount Holly location. So there are patients in Burlington County that are also receiving these portable food box, just not in a very interactive way, where in Camden they have access to the Healthy Corner Store program, our gardening programs, we have a cooking, Zoom cooking. We have a whole bunch of other things that are a little bit more engaging that's not happening in Burlington, but they could, I don't see why they wouldn't be able to unless there's like a turf situation with it being Gloucester County. Yeah, I see Megan's already got her hand up. So yeah, please.
Hey, in some cases it is a turf thing, but I think that the cool thing about a lot of the community work is we're talking about things that aren't billable services. So we can share best practices, and in fact, I've been talking with April from Virtua about all of the programs that you're mentioning. We have a food pharmacy program. It's in its earlier phases. It's much early on. We're not as far ahead as Virtua, but it's something that we're trying to replicate down in South Jersey. And I think we have to be creative. And I think the component of it that allows us to talk to our neighboring hospital systems is that, we're kind of all in this together, and there is a little bit of overlap, but from a community standpoint, we can actually leverage that versus, if we're talking about physicians and things like that, it starts to get a little hairy with, payers and things, but we have the opportunity to do that. And I'm actively having conversations with April from Virtua and some of the other folks, the folks from Cooper and Penn and Jefferson as well. And we're all trying to put our heads around this. And to Leslie's point, I know we have a partnership with Rowan, the School of Osteopathic Medicine, I believe, and we are a teaching hospital. So I'm sure that is something that we're working to expand. I know I'm actually participating in our pharmacy residency program. So, we're even expanding some of our teaching curriculum to include a community component, which is also really exciting.
So I would just add to that, Megan, this is as baffling to us as anybody else. All right, a little bit of Rowan dirty laundry. Our dean didn't even know about this until we all read the press release. So Virtua is taking over SOM.
They're taking over SOM.
They're taking SOM. SOM is, yeah, I'm telling you, and believe me, we think the same things. And the other thing that baffles me is Inspira has a hospital on our campus.
Uh-huh. Yep.
So
Literally.
I'm like,
literally.
And I'm like,
yes.
okay, what's up with that? I don't
It's
know.
right
I am not near the levels of people who make those decisions, but I do think about also, like, it would be great if, like, those community health arms from Virtua and Inspira, if there could be kind of some sharing, collaboration, like I think about, like, if we were to do like a food production class, Inspira would have a commercial grade kitchen. Heck, Rowan has a commercial grade kitchen. Now it's used, I mean, these get used all the time. I don't know how accessible they would be, but like, I think about that, like, could there be some kind of, say we wanted to have a class for people to learn how to, can and turn their foodstuffs into things they could sell, or would Inspira, from our Glassboro campus be willing to, give out these prescription dollars and, in some way, pay for those. I don't know. I'm just kind of.
I would say yes. I mean, we're still in the infancy phases of our food insecurity work. So, if we had already had that established, then I would say, of course, we'd be willing and able to do it. I think it's just a matter of figuring out how we can scale the work that we're currently doing. But I know, just, based on my experience and even our new leadership, there's such a heavy focus on community, and to me, it's really authentic. And so I think the possibilities are really endless. It really would just be a matter of figuring out, you know, the logistics of it, the costs, and then, you know, all that fun stuff.
Yeah.
And just to throw out there, one of the challenges Virtua's faced with these prescription food bucks has been the referral process. Those who are out of network identify that positive food insecurity screening. They'll flag lots of patients that we could help. But the system that they use to refer those patients doesn't get into the system that Virtua uses to get them into the wellness programs that then risk prevention can help and recruit. And so we're now, they've kind of fixed that problem. I believe using the Aunt Bertha platform because it's very easy and universal. And now they're just kind of ramping up their workforce to take in double the amount of patients that are wanting these programs and services. So getting those affiliates who have maybe the name Inspira, but aren't actually part of the system, you know, those are some of the little hurdles that we've had to come across, you know, as you know, health systems are getting into the grocery business, and like how you can really get everyone into these programs. It takes a while to build it out, and I've seen this firsthand, and just from like a spectator on the community side. So
I couldn't agree more. I think, you know, the conversations that we're having internally are about, you know, if we ask questions like this, we ask questions about food insecurity, that we have a moral obligation to respond to that question. So, you know, if I'm Megan, the patient, and somebody said, one of my physicians or a nurse says to me, "Oh, are you experiencing food insecurity?" And I say, "Yes." I'm thinking, okay, well, what are they going to do with this information? You know, what am I going to get out of this if I say yes? Are they going to help me? And so we have to make sure that we are not only asking the questions, first of all, in a way that are, you know, agreeable, and that patients are okay with answering and they feel comfortable answering. But at the back end of it, how do we know that we have a resource for that person and the connection is made? And that's where I know these platforms come into play, is that they're almost functioning as a referral tracker with social services. And, you know, we have that system in place for our clinical needs. And so we're trying to replicate that, you know, with the social needs. And I know that's where Aunt Bertha and Find Help comes into play, but it's not a perfect science, because, you know, at the end of the day, where we get stuck is that we have the social service agencies who we really would love for them to tell us, "Hey, your patient came and saw me," but there's no reason that they should do that besides goodwill. You know, there really is no incentive. What's in it for them? They're doing their service, they're providing service to their population, and they're meeting the needs of their population. So it's about kind of building that relationship in a way that we can have that, I guess, two-way street of information.
yeah, April calls it clicks. A lot of people in the trenches will skip some of these questions, like, do you know where your next meal is coming from? Because it's another click to go through patient intake. And so there's training at that level that has to happen too.
Definitely.
Yes, Carrie.
I was just going to say, I think, you know, with, I love this idea, and I love to hear that it's working and that it's being discussed, because, you know, it's not only food insecurity that this could work with, it's housing, and it's, you know, all these other social determinants of health, you know, support systems and things like that, that the healthcare system can kind of diagnose or write a prescription for, like, hey, if they had housing, you know, and then they'd have the ability for X, Y, and Z of their needs to be met. And so I think this really is going to open the door to having those other needs being met from another entity, not just social services, because you're going to have families that or individuals that don't necessarily have anything to do with a social service program or network, you know, because it's more of health related, but other things can happen, or maybe they're too, you know, proud to use social service programming that's available to them. So they're, you know, maybe they feel more comfortable expressing their needs to a healthcare provider. So, you know, I'm excited to hear, like I said, that this is working in respect to, you know, an area. And so I'm hopeful that we can come together and expand it. So exciting stuff.
Yeah, thank you. And the sea change really came from healthcare changing how they would ask questions to the patients. And this is another anecdote from April. A nutritionist would always, you know, talk to patients, of course, about the condition and what they need to do, and they have to come in 2 days a week or whatever it is and get in this regimen and buy these foods and eat these things. But they never once thought when the patients were no-show to call and check and say, hey, how come you didn't show up? And only to learn that they didn't have the mobility to get there. They didn't have a ride. And why weren't you sticking to this diet? They didn't have the food. They didn't have the money. It was that extra question that the providers just, it never occurred to them. And so that change kind of created these opportunities to really think about the screening being broadened to a social determinant, and then leveraging that to then prescribe the foods, and even, you know, virtual will pay for Uber rides. You know, they can't advertise it because of competition with other health systems, but they will do that. If you can't make that appointment because of a ride, they will pay for the ride. If you can't afford the food, they will give you the food. And so that paradigm shift has really made the biggest difference from what I've been told from physicians in how they approach all this work and why they support it in a deep, meaningful way, as opposed to just like, oh, check this off that we've done something for the community. You know, they are genuine, because now they really understand how complex the environment, you know, the role that the environment plays in health is. And so, yeah, I'm also encouraged, Carrie. So yeah, I did put together some influences from policies that we've been benefiting from, just to share. This is much lighter, I promise you. Just wanted you guys to kind of understand what the heck we've been doing. But these are some of the things that you might be able to think about. The first one was our Food Security Board that was established by the city in 2009, which looked at all sorts of issues around food access. But the one that I wanted to flag was the Adopt a Lot program had been very successful for many years. The city has a staggering amount of vacant and underutilized land, and families were allowed to access that land for many years and were able to grow food on it. Unfortunately, there was some abuse, people building driveways and swimming pools, and so the city kind of scaled it back, which was not a great response. I mean, it had to be addressed. But that really limited our access to land after the Adopt a Lot program sort of got compromised, and we are working to fix that. But the point was that we really ramped up food growing in the city once this was available, because it made land so much easier to access. And so our partners that were invested in gardening could give all the resources to their families, and the families had a place to actually grow their food. And the success of this is evident in the Michelle Obama book, where there's a 2-page spread on gardening in Camden alone. I mean, it was one of the highest per capitas of urban gardens in the US. And then, so separate from the Security Board, which is government and private working together, Campbell's Foundation had invested $2 million over 10 years with the help of Camden Coalition on a variety of food access initiatives. And although that has sunsetted, they teamed up with the food bank to create the Food Security Collective. This is not a board, this is not governmental, but it's taken two of the biggest players in health and food to really think about systemically what policies they can influence the city and the Food Security Board to go for. So these giants have recruited all of us smaller groups. I mean, risk prevention kind of falls in the middle category there. We're trying to increase disposable income. We're also trying to get towards the stakeholder, but we don't have the bandwidth to manage the systems change that is policy. So we have a Food Security Collective that is making these recommendations, that is bringing every person, it's bringing the Inspira, the Glassboro, churches and everyone else, to the table and brainstorming on what is really needed to move the needle. And we've come up with a network of health hubs addressing employment, again, social determinants, thinking about subsidized housing, all these other things that we can't alone in risk prevention manage. So the collective really is bringing everyone, on the same table to really give the food security board more ammo to go for additional changes to policies. From the state, and some of you may already know about this, the New Jersey Food Democracy was formed about a year ago. And this is an early start to having a statewide food policy council. And these are great advocates for the resources that are needed in our urban communities, especially as it ties into better access to SNAP and WIC data, knowing where those resources are being used. New Jersey is not very transparent about those tools, and also being a sounding board between the state and our local municipalities as it relates to obstacles and hurdles that are preventing people from getting involved in their local food system, whether it's livestock or it's having the resources to develop a garden, or getting other agencies to support this work, which is another important component. So the Food Democracy, they meet pretty often. I think it's once a month. And then they have lots of great resources, good networking that we've been involved with. And then, hey, look, there's Inspira. There's the Community Needs Health Assessment, and making sure that you're working with folks like Megan so that food access, gardening, and all these resources make their way into the plan so that their foundation and their support is justified by the CHNA. So we would not have been able to do what we've accomplished in just 2 years out of the 10 plus years I've worked on this without the support of the CHNA from Virtuous side. So it's revisited every 2 years, I believe. And so shout out to that policy.
Every 3 years.
3 years, thank you. And it was a way to really get health systems to think about how to reduce patients coming and going. And it's been pretty effective. It really has been a successful policy top down from the federal level.
Mm-hmm.
HIAs, anyone familiar? They started on the West Coast, but they're making their way this way.
Been on some webinars about them.
Yeah, so they don't really have teeth over in the East Coast, but the reason I put them in is many of us may be familiar with carbon footprints. Companies that don't do a great job on the environment can pay for greener initiatives to offset the impact that they have on the environment. There is ways of creating a similar funding source through health impact assessments. So as communities, that have a policy like this, it just is a review. It's a review of a plan before it's constructed. And for example, if a community wanted to build a new high school, they were going to put it way out in some farm country site where the land was cheap, available, and big, as opposed to close to where people live. The HIA would call out, there's no way for anyone to walk there, bike there. They'll have to take a bus, things like that. Or it could be a building that's going up that doesn't have accessible stairs, so everyone has to use an escalator, elevator. It's not convenient to transit, so you have less people being able to use other modes. So an HIA can just point out what aspects of a development might contribute to less healthy outcomes. And what you can do with that policy is create a health impact footprint fund, where a company like Subaru, for example, when they built in Camden, not very transit, not very walkable, very kind of suburban style. I'm not faulting North America's headquarters. I'm told it actually was Tokyo that wanted this design from National. But we could have said, okay, well, to offset the fact that you can't easily walk or take transit, this amount of money could go into a fund that would fund health promoting programs. And that would give us a sustained revenue to develop more space to grow food, create trails, do other things to undo the negative impacts of that development. And it wouldn't seem arbitrary because HIA gives a framework that scores how a building's development, its siting, and its layout is impacting not only health, but also influencing healthy decisions. So it gives us, the groups, a little bit more sway in talking to these giants, because it's not like we're making up the rules. We're like, here's the framework, and here's what you're proposing, and here's where it doesn't line up, and here's what the offset could look like. So it really makes this process transparent, where we could get funding from the private sector to promote more health related work, should they not want to make changes to their site and their building for a variety of reasons. Not necessarily their fault either. It's expensive to have an architect redo a whole building when it goes up to review. And then the last policy is the one that we're trying to work on. Medicaid has recently, at least thanks to the Affordable Care Act, provided expansion in the Medicaid managed long-term service and supports area. So organizations that formerly relied on grants, grant writing, philanthropy, that were working in an area that overlaps with disease prevention, are in a position now where they can get supported by Medicare. They can become a Medicare service provider, which means they can focus on working on the health and well-being of their population and not grants. And that's when we're talking about gardening, when we have very demanding seasons of producing food, the last thing I would like to see for urban farmers is having to deal with grants, grant reports, quarterly reports, and competing with each other on limited resources. And so, you know, a good example is Mana, that took Meals on Wheels and customized it to treat patients with specific dietary needs. And they are now supported by Medicaid, so they can continue to prepare those meals. If we can make the case that urban agriculture keeps folks out of the hospital, saving lives and saving healthcare, we'd love to see how our garden training programs could be funded and supported by Medicare and Medicaid, excuse me. So this is a state level policy change that would have to happen. And we're grateful that we have a Medicaid provider through Horizon Blue Cross that can kind of help us come up with a strategy on how to get those changes so that an NPO can, a managed plan organization, can actually support this work. And this isn't just like a pie in the sky. This is happening in other areas. In Massachusetts, for example, in Washington, D.C., what they're doing is they actually created a calculation of how much money the health system is being saved by keeping patients out. And they're taking that savings, they're cutting it in half and taking that money and giving it to those involved in keeping those folks healthy. And so this does work. The arrangement is happening. We just haven't quite gotten to the point where Medicaid managed plans are supporting urban agriculture. But again, we're working with our healthcare providers, and if our friends at Rowan can collect the right data to make the most compelling arguments, that's our long-term sustainability goal, is to get that support from Medicaid. And then we're at the last section, but I wanted to pause to see if anyone had questions on that, on those issues. So we'll have a few minutes to talk, but I just wanted to recognize and acknowledge the excess produce, because you guys had heard we're interested in this topic. We don't have a whole lot about it, but in terms of the surplus grown and the food waste, we're very much interested in addressing both of them. I mean, food waste, 146 million tons end up in landfills. That's a whole other conversation I'd love to talk about another day. But we are, you know, as I mentioned with produce, you know, retailers love to overstock and not have a plan on what to do after it doesn't sell. But at least with the surplus, this is an issue we want to make sure is addressed ahead of the curve, because as we have farmers growing produce, we don't want to make sure in a city that has such a high rate of food insecurity that it's not getting anywhere. So at Virtua, they put together these spreadsheets that we have began assigning our growers produce. And this was a good learning lesson from last year. We started this where we wanted the mobile market and the mobile grocery store and the food pantry to have like a variety of produce grown by the city. And we realized that just doesn't work, because patients would get excited to try different things that were grown here. but we didn't have enough quantity because our growers are doing a little bit of this, a little bit of that. So the first step we wanted to do was to really give a member of the community a specific item that they'd be responsible for, and another to kind of be the backup. So we have one organization, Center for Environmental Transformations. They're going to focus on specific crop types. Carrots is a thing that they're really good at. So our commercial grower who ensures the quality and conditions and kind of takes on liability, they're not going to grow any of that. And so we're trying to make sure that specific crops are going to be completely sustained by our 4 pilot growers. And understanding that they're going to still have to put excess in the ground, we're making sure that we're already having the conversations with the aggregator for our corner stores, so that our healthy corner stores might also be able to carry that excess produce. And if that doesn't happen, Cathedral Kitchen is lined up next to kind of help kind of carry that through. So we have Cathedral Kitchen, and they're a very dynamic food pantry that also works on social determinants and job training. So they're going to be willing and able to also get some of that produce. And then certainly the Food Bank of South Jersey has a distribution system to kind of mitigate that as well, kind of bringing the need where it has to go. But they also have data. They collect data on the food pantries, so we don't have to. So we can really start to think about maybe instead of corner stores alone being a resource for some of the wraparound support and programming that is at the Wellness Center, some of these corner stores can share that work with a food pantry, and that food pantry can also take some of the produce that corner store couldn't sell. And so we're really trying to figure out how to create a better communicative relationship between food pantries and our corner stores ahead of having this problem blow up in our face. And then they also have their Hope Mobile, and that also goes around to different locations, much the same way as the mobile grocery bus does. And so that's some of the ways, and of course my Resource Pal, trying to figure out how to leverage that tool as well to connect additional food under the correct search queries. And we have this food security collective, like I said, dealing with all these buckets of policy, staying engaged with them as well on these issues so that our other partners throughout the city understand and have solutions to propose as well. It's going to be another important component. So so 8 minutes for Q&A. Yes, Tony.
Hey, great job. This is
Thank you.
interesting. So it all piqued my curiosity, but the thing that was really coming up for me is this Medicaid managed long-term services supports work, because you said something along the lines about it's something you're kind of looking at and trying to find evidence for to prove that it works so that you can get the financial support. Maybe go a little deeper on that, because what do you need?
Yeah, so we would love to organize our what we call it the farm to pharmacy. So risk prevention, we have the prescription, and then we have this farm to pharmacy, which is all about connecting growers and patients to opportunities to grow and sell produce back to Virtua. They need training. And so if we could take our routes to market and our gardening training programs and make them eligible to be a Medicaid social service provider in the space of, like Manna, but instead of preparing the meals, we're helping them learn how to produce those meals. Preferably the ingredients, the produce itself. And if we can show that by giving the patient population and those most vulnerable the resources to grow and sell produce, they're less likely to end up in the hospital because they have not only the income, not only the supply, but now what has been missing historically is the demand. We have families that are several generations removed from preparing and eating a lot of fresh foods. So bringing a dump truck of produce is great, but it's not really going to fix the challenge of intergenerational food deserts. You have to drive up demand. And there's lots and lots of evidence to show that when people are growing food, they're more likely to eat that healthy food versus someone who's just introduced to it at a market. Like, here, try this kale. I will say personally, I hate mushrooms, and I will eat them if I'm putting them and sauteing them in a skillet for 5-10 minutes. I don't know what that's called, but there is some psychology about when you produce something, you know, and the other thing to say to that is that we understand that it's health promoting employment. A lot of the bad eating habits we have is because of our work environment. And so if we can take that force that has made us sick and just swap out the bad food with the good food, if they're around it all the time, they're going to end up consuming it and bringing it home. It's going to do, you know, wonders. So being
That
the
is
service
definitely-
provider.
That is definitely clear, but what do you really need to prove to the Medicaid group that you could be paid for this? Do you need like a research study, a certain number of patient population, or?
Well, we need to get, what I understand, we need to have some changes that have to be voted and decided at the state level. That would make
Okay.
it something.
So advocacy.
Yeah, advocacy. But I'm trying to get in touch with someone from Verizon. There's a new point person at Horizon. I said Verizon. Horizon Blue Cross that that might be able to see what the parameters are in their existing program, where they might be able to support us without changes at the state level. But that's great for Canada. But if we wanted to replicate this across the state, it's at some point we're going to have to confront how NG Family Care can acknowledge this process.
National Network of Public Health Law. That's a really great group. It's free. It's resource It's one of RWJF's programs, and they provide. I can probably reach out to you and get you this information, but they can help with food policy support and advocacy. They're very knowledgeable.
I love it. Yeah, I've definitely heard of them. So thank you so much.
Okay, everyone, we've come to the witching hour and we've had a wonderful time today. Jonathan, just exquisite and so interesting. So thank you for putting together such a thorough and informative workshop for us. And I want to give a shout out to Minar, who wrote the grant so that we could collaborate with you in Camden and have this wonderful presentation. I'm sure that all of us are just like simmering with the questions and ideas and yearning to talk to one another again. Our next meeting, everyone, is actually scheduled for April 22nd at 3 o'clock, and I will allow for time for brainstorming at that meeting. But I'd like to ask you all to feel free to reach out to one another in smaller groups, to caucus, if you will, to talk about what kinds of things we might get up to together, because it's hugely exciting. And Jonathan, I just want to know if you want to expand to Glassboro, you know, like expand your territory a bit and become our coach or something. Anyway, could everyone unmute and let's properly thank Jonathan with a round of applause. Yeah.
Thank you.
Great job. Fantastic. Woo-hoo.
Thank you for sticking in for that. So it's a lot of info, a lot of lessons learned, and really tried to put it into chunks so it's digestible.